Hello, I'm Jun Li, a professor of hepatology at the first affiliated hospital, Zhejiang University School of Medicine. This video abstract relates to our article, New Diagnostic Criteria and Prognostic Score for HBV-related acute-on-chronic liver failure, COSSH-ACLF, which was recently published in Gut. As you know, ACLF is a complex syndrome with a high short-term mortality of 50 to 90%. Early diagnosis and prognosis for intensive treatment are very important to decrease this unacceptable high mortality. However, the currently used criteria of CLIF-ACLF based on cirrhosis, irrespective of etiology, remains controversial. This study aimed to clarify the clinical characteristics of patients with HBV-ACLF in a prospective multicenter study and to develop new diagnostic criteria and prognostic score for such patients. Total of 1,322 hospitalized patients with acute decompensated cirrhosis or severe liver injury due to the chronic hepatitis B were enrolled for analysis. The results showed that HBV-ACLF patients exhibited different clinical characteristics from those of alcoholic liver disease-related ACLF in Western populations, including hepatitis B as the main etiology in Eastern countries. Liver failure was main type of the organ failure in HBV-ACLF, and kidney failure was more common in ALD-related ACLF. The short-term mortality of patients with HBV etiology were significantly higher than those with ALD. According to above results, irrespective of cirrhosis, we proposed that patients with chronic hepatitis B, TB more than 12 times, and INR more than 1.5 should be considered as additional diagnostic indicators of HBV-ACLF, and nearly 20% of patients with an HBV etiology further diagnosed with ACLF. The subsequent follow-up showed a significantly lower 28-day mortality in the external validation group compared with the derivation group. The new COSSH score, mainly based on TB, INR, and age, was also better than CLIF score for predicting short-term mortality of HBV-ACLF patients. Taken together, our COSSH criteria bridge the gap in the CLIF criteria for HBV-ACLF diagnosis, and more patients will receive early intensive treatment, which may be useful to reduce the unacceptable high mortality. Detailed information could be reached in our paper. Thanks for your attention. We would appreciate your input for research-related questions or information. Please contact us by email.